In the early phase, there is a mortality of the kids. Sometimes many kids die needlessly. There are the two very important factors that need the consideration of the kid mortality. One, this when the animal born, it is very prone to the hypothermia from the exposure because it's a small animal and the surface area is larger. And when it is born, there's a little fat for the insulations, not providing the exposure, not providing the sufficient, the possibility for from the environment, especially the winter season or the harsh seasons, and limited energy reserve. So because of this factor, it is very prone to the exposure to the environment. The kids are born with an inexperienced immune system. It means there is no antibody on the system, and such animal is very susceptible to the infection. So because of the two main reasons, there is a mortality is very high. The mortality is varying from system to system, from the rearing system to system. Average, there is a 20% of the kid lost every year. It is very high in where that has been reared in the farmer system, and they are not providing any kind of the preventive measures. So in the different agroclimatic conditions, the mortality is varies, but definitely it is a cause of concern in every places. But overall mortality comes to the 22%. In the kid mortality, management play a very important role. It is a key in the kid mortality. If you see certain statistics or figures in the different rearing models, in the farmers' flocks, the mortality is 22% almost. And the commercial and organized farmers, those are adopting certain technology, the mortality reduced to the 70%. At our CIRG, we are also maintaining almost 4,000 goats, and we have all type of the vigilant methodology to identify the disease and control a disease. The mortality is declined to almost 5%. So the management is playing a very important role in the control of mortality. There are the two very important diseases that are responsible for the kid mortality. First is the diarrhea, and second is the pneumonia. Besides this, there are certain other problems like weakness, certain infectious diseases, insufficiency of the milk, and some other problems that associated with the kid mortality. But diarrhea is the biggest problem, biggest killer of the young ones, and then comes the pneumonia. So if you see the kid mortality as an overview, there are the three very important factors that is responsible for the loss of the kids. One is the mother factors. Mother factors means when mother is not getting the proper nutrition. There is a low production syndrome, underfed animal, especially the pregnant animal, where the demand of the energy nutrient is very high. If it is lesser, then mother is not able to provide the good nutrition to the fetus. So because of the poor nutrition to the kids, the placental growth is not proper, fetal growth is not proper, and the deposition of the fetal fat that is required immediately after birth, it is not proper. So the animals comes under the weaker stage. The mother factor is very important. If you are maintaining the mother at a proper nutrient and ration, and then it means your developing fetus is optimum, and there is a lesser risk after the birth for any disease condition. Second factor is the kid factors. After the born, the kid is also exposed to the environment, and then kid is also exposed to the different kind of the infection, the premises. There may be different infectious diseases. And the most important is managemental factors. If the management, it is mismanagement, then other factors also become a more pronounced factors. In management, especially the sanitation and hygiene. Sanitation and hygiene is a very key in all animal husbandry farming system. Rearing practices, shelter management, and some judicious and timely prophylactic measures that need to be adopted for the adult animals, it is very important. So all three factors, mother factors, kid factors, management factors, need a proper attention when you overview the kid mortality, and then you provide the strategy to control the mortality. Now there are the different regions for that. If you classify the regions, there are the two types of the region: infectious region, responsible bacteria, viruses, protozoa, and they are responsible for the mortality. And there are certain non-infectious causes. Sometimes they are become a major role in the kid mortality. So we will see what is their role and how you can identify these regions causing the mortality. Now we come to the one of the most important, biggest killer or biggest region of the mortality is the neonatal diarrhea. The neonatal diarrhea, it is a complex. There are various organisms, various regions are associated with the neonatal diarrhea. Among the infectious region, the commonest one are E. coli, Clostridium perfringens. Although this Clostridium perfringens is taken as a important cause of mortality as a enterotoxemia in the growing animal, but the Clostridium perfringens is also playing a role in the younger life as a associated organism causing the mortality. The two important viruses, rotavirus, especially group A virus, bovine coronavirus, they are the important viral diseases. Cryptosporidium, which is a protozoan, and Salmonella. These are the group of organisms which are commonly associated. So either they are causing a single disease, but most of the time, the 2 or 3 and 4 organisms are associated at one time, and they are disturbing the mucosal immunity. And finally, the E. coli, which is already a common inhabitant and very commonly available in the environment and a common opportunity to the young kids for infection of E. coli. This E. coli become a predominant organism in the last and causing the toxemia and a lot of clinical problem to the animals. So ultimately, the diarrhea is a major sign of this infectious region. So the non-infectious region, they are also there. There may be some dietary errors, overfeeding of the milk, and generally the dietary errors, the general response when you make a desirable changes. If there's overfeeding, you are restricting the feeding, and then very easily responds. So the majorly the infectious regions play a very important role. In the first of all, one of the most important fatal is the Escherichia coli, that is known as Colibacillosis, and it is mainly oral infection, either through the suckling of the dam. If the udder is not properly disinfected or clean, the chances of the oral infection is very high. And E. coli, there are a number of the pathotypes and serotypes are involved. These are the enteropathogenic, enterotoxigenic, cetotoxin. So they are the very pathogenic serotypes are involved in the colibacillosis. There are the broad type of the two clinical syndromes. One is diarrheic syndrome and septicemic syndrome. Diarrheic syndrome, there is a diarrhea. It may be white color diarrhea, green color diarrhea, yellow color diarrhea, then leading to the different degree of the dehydration. And if the animal is not being properly taken care of by restoring the rehydrations and the antibiotic therapy, the animal may die. So this type of the clinical syndrome is very common in 1 to 30 days of kids. The another form of the colibacillosis, it is septicemic form. The septicemic form is more dangerous, more fatal, where the animal becomes suddenly loose, is not able to stand up, is not able to suckle the dam. So the animal is, the death is very common. So we have to see both the conditions. You have to be very vigilant about the septicemic form of the colibacillosis. If you see the management of the colibacillosis, it's totally depend upon the antibiotics. There are a lot different group of the antibiotics are available. So the oral antibiotic and systemic route of administration therapy. Oral antibiotics is very good when you are giving to the animals, means it's directly reaching to the intestine and checking the multiplication of the bacteria. But the systemic antibiotics is also very essential. So the combination of the oral and systemic route of antibacterial therapy works more nicely than a single route of the administration. There are the number of the groups like the aminoglycosides like gentamicin, cephalosporin, enrofloxacin, and then the judicious dehydration therapy is important, either by subcut or by intravenous routes. The enrofloxacin generally is not being recommended in the younger animals because of their complication in the development of the bone. But whenever there is a problem and the drug is responding, you can use the enrofloxacin for a smaller period of time. So long therapy is not advisable. If you have other option, better option, you can use other antibiotics. But in exigency and emergency, enrofloxacin can also be recommended. But because of this antibiotic therapy, the drug resistance is a very common problem. We are mapping this drug resistance since last 10 years, and we're also running a project. So we find that the resistance is very faster, and you will find that the drug is not working. So if you see the vaccination, we do not have any vaccine at present in our country. But we also experimented on the different ways. We utilized the common serotypes in a farm, identified, and involving important serotypes, we made a killed bacterium, and that can be used in them. And this is very effective to provide the passive immunization, better passive immunization to the younger animal. But it is a farm-specific vaccine, means you are utilizing the commonest serotype. Now, if you see the antimicrobial resistance, it's sometimes become a more problem than the actual problem, because the E. coli is the most important organism having a zoonotic importance. So the therapy with the antimicrobial is an important role and need the attention of the veterinary professionals. We also mapping this antimicrobial. You'll find that the all class of the antibiotics like aminoglycosides, cephalosporin, sulfonamides, penicillin, they're all getting the resistance, especially the farm isolates. Means when we are exposing the animal to the repetitive antibiotic doses, they become more resistant in comparison to the field isolates. So we also find out the most I'm say the out of the all pathotype and serotypes, the Zika toxin is most dangerous. It is also gaining resistance against the different type of the antibiotics. And we also measured and identified the different AMR genotypes that having the tetracyclines, sulfonamides, streptomycin, chlorphenicol. It means the resistance is in a problem, especially in the E. coli when we are exposing the different type of the drugs. Now we come to the another disease which is also important sometimes, that is a cryptosporidiasis. It is a protozoal disease caused by the Cryptosporidium parvum. This disease is very commonly observed in the younger phase of the life, that is up to 30 days of life. Sometimes this disease is very milder. You do not find a very clinical episodes that are responsible for the death of the animals. Only there is some diarrhea, fever, anorexia, and there is that frequently responds. But most of the time, this Cryptosporidia is not a single cause of a disease. It involving the other pathogens like viruses and other common bacteria. So sometimes you'll find the oocysts are coming with a higher rates. If it is 1,000 and 2,000, it's give a clinical picture of the Cryptosporidia. In this situation, you will find a specific therapy. If in diarrhea, mostly is dominated by the bacteria. But if it is a Cryptosporidia, you need a special drugs. For the treatment of the Cryptosporidia, the drug is nitazoxanide has been recommended. And for a younger animal or the juvenile animals, 100 mg twice a day for 3 days. It's proved to be successful in preventing the natural disease in kids. So second, the important disease is pneumonia. That poses a problem to the farmers in the younger stage of life. It is a disease caused by the pathogens, bacteria. There are the different type of the bacteria and the mycoplasma. Especially this pneumonia in the younger life, the environmental stress is playing a very important role. Means whenever there is a increase of the temperature, there is a decrease of a temperature, you will find there is an occurrence of the pneumonia. So in the time where there is a low temperature, especially winter season, and the season where it's a summer season, you will find the sudden rise of the temperature, and this environmental shock to the animal is precipitated the pneumonia. Second most, one of the important stress is weaning stress. At the 3 month of time when the animal is weaned from the mother, and at this stage the pneumonia is also become a problem. So it precipitates. So this disease, pneumonia, can be identified very easily by the farmers. There is a respiratory distress, nasal discharge, and if it is not being treated, animal may die also. But it needs a better treatment approach, because the pneumonia is involving the different type of the bacteria, even mycoplasma mycotis var Caprine is one of the important isolates. So if you see the involvement of the different type of the organism, you need to select antibiotics which is really a broad spectrum in nature. And that is also working against the mycoplasma. Against the mycoplasma, only 3 drugs is responding: tetracycline, tiamotine, and endofloxacin. So your selection should be a better approach to control the pneumonia. Otherwise, the pneumonia is associated with the managemental factors. Means you have to avoid the sudden shock of the environment, cold shock, heat shock, or weaning stress. So you are managing the stress, you are managing the pneumonia. Naval infection associated problems. If you see the entry of the infection to the younger kids, they are the two major portals. Either the young one is getting the infection through the oral routes, means contaminated waters, suckling the infected udder. So there is a oral infection is playing an important role. If you see the other route of the infection is the naval infections. By the way, sometimes the navel is being detached or damaged, it becomes a portal of entry of the infection. And the different type of the organism, especially the E. coli, staphylococci, or even this Clostridium tetani is also gain entrance to this portal of entry. When there is a naval infection, it leads to the naval infection. It is very commonly known as naval ill, Encephalitis. And then the infection is reached to the joints. It is causing the joint enlargement of the joint, painful joints. If the infection reaching to the nearby organ from the navel is liver, it causing the hepatitis. Infection reaching to the pneumonia, lungs to the pneumonia, and finally the vital organ is affected and there is a mortality. So the naval infection is also one of the important portal of entry. So farmers or the veterinary professionals need a very attention, and although it is a very common advice to the goat farmers or the sheep farmers to apply the antibiotics or apply the antibacterial, especially the povidone or Savlon, to the tincture iodine to the navel immediately after the born and up to the almost 1 week at least till it is being shed off. Otherwise, there is a lot of opportunity of the entrance of the organism, and you can see the figures. The farmers has to pay the penalty of this very low cost practice. Among the infectious diseases, the FMD is also one of the region. And generally, in our practice in the field conditions, the goat and sheep is not being commonly vaccinated against the FMD. So the young born is not protected against the FMD. FMD in the sheep and goats is also one of the clinical malady, but not very common, not very, I would say, the acuteness as in found in the cattle. But there is a very high risk in the younger animals because this virus is damaging the myocardium. It is causing the inflammation of the myocardium. It is causing the myocarditis. And there is a I would say, the damage to the myocardium, and there is a necrosis. There's a line of necrosis, and if you see the closely in the postmortem, the line of necrosis is followed by the healthy tissues. It gives a appearance of the tiger skin, so it is known as tiger heart. So if you see the mortality in a young one, if you have 100 animal in the evening and there is a FMD, and in the morning you will find all the 100 animal will die. There is no diarrhea, there is no pneumonia, there is certain death being found in the FMD. So the vaccination of the adult animal is very necessary, not only for the adult animal, but definitely to save the life of the young animal, to provide the better passive immunization to the kids. This is a disease that needs introduction to the veterinary professionals. There's CAE. It is an exotic disease. This disease is not occurring in our country. Caprine, arthritis, encephalitis. And this is a disease being diagnosed in 1974, very prevalent in Canada, France, Norway, Switzerland, and the United States, especially in a seroprevalence rate is exceeding 65%. But in our country, the CAE is not there, but there are certain serological evidences. Why I am describing this disease here in this platform? Because this is a disease which is under vigilance in our country. We are collecting the sample from the different portion of the country and try to find out what are the level of the antibodies against CAE. So that is the responsibility of our veterinary professionals to know the CAE. CAE is a viral disease. It is the most important feature of the CAE, that this infection is transmitted through the colostrum. If you know, the colostrum is taken as a boon to the younger animal that provides the antibody production to the younger phase of life. But here it is not a boon in case of the CAE especially. So if you see the younger animal, the encephalitis form is common. in the young age of life, 2 to 4 months of age, and there is a paralysis that lead to the seizures and death. In adult animal, there is a neurated mastitis and there arthritis, and it's a very, I would say, the very dangerous disease, because the virus is coming to the colostrum, means there is infection, and then the young animal will get the infection. So there's a lot of approaches is required to avoid the colostrum infection to the young animal by providing the pasteurized heat-treated colostrum milk, or the animal has to be kept on the milk replacer. So this needs a discussion. Now, in the younger phase of life, at the 1.5 month, the 2 month of time, sometimes the young animal face the tapeworm infestation. The farmers is complaining commonly that in the 2 month of age, the animal is not gaining proper weight. So tapeworm is one of the opportunity. There is a strong possibility. There are the various type of the Monagia, and Avitline is responsible for this tapeworm infection. And tapeworm infection, although it is causing the infection in all age group of the animals, but the adult animal generally tolerate the infections and there is no clinical sign. Only they are providing the infection to the younger animal. In younger animal, especially 2 to 6 months of time, this tapeworm become a clinical problem. And there is a clinical sign, because this tapeworm is occupying the space in the intestine and they are disturbing the digestibility, absorption of the nutrients. So animal become a weak animal or poor growth animals, and animal is not responding to the treatments. And what we observe in the case of the tapeworm infestation, when tapeworm is occupying the space, and between the space there is a creation of the anaerobiasis. Means this anaerobiasis is very, I would say, it is suitable as a predisposing factor for the Clostridium infection. So the animal is having the tapeworm infestation is more liable for the Clostridium infection because of the anaerobic loops in the intestine. So as a symptoms in the tapeworm infestation, it's maybe diarrhea, malabsorption, and depression, rough body coats, pot-bellied, and stunted growths. And here you need a examination of the fecal for the typical tapeworm act, and then you can confirm it is a tapeworm infection. And you need a very special class of the enthalmatic. General class of enthalmatic is not being responding, so you need a different class. The most important drugs, which is very commonly effective against the tapeworm infections, are niclosamide, 50 to 100 mg per kg body weights, and this is a very unique drug which is not at all being used from the intestine. So whatever the drug you are giving to the animal is totally available to kill the parasites. Very safe medicine. The second is the praziquantel, 5 mg per kg body weights, and the fenbendazole is also very effective, but you have to give a repetitive dose. Generally, the treatment approach of the tapeworm infestants requires a repetition of the treatment. Generally, one dose is not very effective. So you need a repetitions continuously for 1, 2 to 3 days, and also required to repeat the medicine after 2 to 3 weeks of time. Then you can control the tapeworm. As you know, the tapeworm, the infection is coming from the adult animals. So whenever there's infection rises in the farm, in the younger animal, you can also treat the adult animal by using these medicines. So means you are decreasing the load of the infection in the environment, and you can better control the tapeworm infection in the younger animals. The Coccidiosis is a viral disease, although not a very economic disease, but sometimes the case is being complicated. The younger animals sometimes is having a lot of pustular lesions on the lips, and that is extending to the buccal cavity, and the young one become very, I would say, frustrated. He is not able to suckle the dam, and there is inanition, and animal may die also. So it is a responsibility whenever there is an infection of Coccidiosis and 1 or 2 lesions on the face or the udder of the goat and sheep, and immediately it should be controlled by applying the antiseptics. And if there is secondary infection, you can use the antibiotics and you can apply the antiseptic cream. Although there is no vaccination, but this disease also need a vaccines. In the international market, vaccine is available with the combination with the pox. Otherwise, the morbidity is very high. a lot of approaches is being adopted to control this Colibacillois by using the different antivirals or different emollients, gel or spray. But this disease need a early attention of the farmers. As soon as there are few lesions on the face, you should promptly active to control this disease. In younger animals, sometimes the vitamin and the thyroxine problem, that is goiter, where is the iodine deficiency playing a very important role. If you can see in the thyroid, in this the enlargement of the thyroids, that is known as goiter, and sometimes the animal stillbirth born or the born deads, or sometimes for a period of time the animal also survives of there's not proper growth of the animals because of this goiter. So in some places where there's iodine deficiency is there in the soil, and they're going to the dams, and dams is having a poor level of iodine, and because of that the younger animals is born with the enlarged thyroids. So there are the different approaches to provide the iodine to the dams and to young one also. So the 2% potassium iodide at the rate of 10 ml per 20 kg to goats, along with the iodized salt, 2% of the concentrate, and it provides the iodide to the goat. There are certain other experimentation being done by the scientists by using the thyroxine at the dose rate of 0.1 mg per kg for 2 months to the kids. That also provides that cure of the goiter. And different preventing approaches like the painting of teeth with the tincture iodine every fortnights is also to provide the iodine to the younger kids. So that depend upon the different agroclimatic condition. If there is a iodine deficiency, better approach to use the iodized salt to provide the continuous iodine to the young ones. Another problem that is need a discussion, the floppy kid syndrome. The floppy kid syndrome, it is as soon as the animal born, it is no problem, but suddenly there is a onset of muscular weakness, paralysis, paraplegia, ataxia, very common in the young phase of life. And there may be other signs like diarrhea and respiratory disease, but it is not necessary. The only thing is that animal is not able to stand up. There is a problem in the getting up. And if you see, there is no the correct reason for the floppy kid syndrome. But if you see the biochemical alteration, it is more diverted to the metabolic acidosis. So metabolic acidosis is the most the pathological the story behind this syndrome. So you have to provide the alkalizers either through the intravenous or oral that can combat the metabolic acidosis. The better approach to go for the soda and salts and mix in the water, then use orally. And the commercial available electrolytes that can also be given along with the other milk, and sodium bicarbonates intravenous that may also be used. So ultimately you are combating the metabolic acidosis, and animal immediately responds. So whenever there is a risk of this type of the clinical conditions, when you are not able to diagnose whether it is a septicemia, muscular dystrophy, some other toxemia, in this situation you can also predict the possibility of the floppy kid syndrome. If you have a possibility of this measuring the electrolytes, you will find the acidosis, and immediately if you are using the alkalizers, and that animal responds. In the nutritional deficiency, white muscle disease, that is also known as nutritional muscular dystrophy, is sometimes become a associated risk in the neonatal mortality. The deficiency of the vitamin E and selenium is the prominent region, and that lead to the muscular degenerations and the paralysis, animal having a stiff legs, respiratory distress. And if this muscular dystrophy is because of the muscular, I'm going to say the degeneration, the cardiac muscle, the animal may die suddenly because of the cardiac arrest. In this situation, the prompt treatment with the vitamin A, injections of selenium and vitamin A, and oral supplement is available, injectable also available, they can be used. And for the preventive measures, you can use the 50 to almost 25 to 50 mg of the vitamin C per kg of concentrate for adults and 50 to 100 mg per kg concentrate feed to the younger ones can be restored the nutritional deficiency, especially vitamin A and selenium. Hypothermia and the hypoglycemia. As you know, the young one, when this is being born, it is having very poor fetal fat reserve. It is born from the weak mother, it is still lesser. So under this situation, there is a risk of hypothermia, there is a risk of hypoglycemia when there is not availability of the proper the amount of the milk. In this situation, so the kids is exposed to the environment very easily, and there is a risk of mortality. In this situation, to provide the nutrition to the young one, the 20% warm dextrose IV, and try to make the environment warmer to the kids so they can survive, they can provide the better temperature, to ensure the colostrum and milk feeding timely, proper amount, and at proper time interval. And you keep and watch the proper timely suckling to those to avoid the hypothermia and hypoglycemia. In the growing stage of time, especially the younger animal, 3 to 4 months of time, especially when the animal is giving a high excess grain, the animal have a risk of developing the uroliths in the urinary tract system. And this is very common in the castrated animal. And because of the urolithiasis, there is a problem in the urination. There is a urinary stasis. And there are other risk factors that promote the urolithiasis, like vitamin A deficiency, disturbing ratio of the calcium and phosphorus. So in this situation, there is a preventive measures involving the heavy grain feeding. It should be controlled. And if there is a pain, you can use the diazepam at the dose range of 0.1 to 0.5 mg per kg and other antispasmodic drugs. And administration of the ammonium chlorides, it change the pH of the urine. It disfavor the formation of uroliths. It can be given at the dose rate of 5 to 10 grams per head per day, or it can be mixed at the level of 2% concentrate ration. If you are maintaining the younger animal on heavy grain diets, it is advisable. In urolithiasis, generally is response, but when there is an acute uroliths or acute obstruction of the urinary tract, it needs a surgical intervention, and if it is not being adopted, there may be a mortality because of the uremia. In the younger animal, 2 months, 3 months of time, the coccidiosis is one of the clinical problems, especially in the intensive system of the management. And this is a protozoan disease, and the infection is generally gained from the adult animal. And the younger animal having a different kind of these symptoms. And acute signs sometimes the diarrhea, pain, and anemia, and mostly it is a chronic one. It depends upon the damage, depend upon the load of the infection, and depend upon the damage of the extent of the intestine. So the chronic is also very important in the intensive system of the management, where the younger animal is not responding to the nutrition and they are stunted growths. Here there are some pictures you can see in the cyst of the coccidia is there. So this picture is showing the damage, extent of the damage of the intestines. A lot of cycle is there in the life cycle of the coccidia, and it is damaging to the epithelium. And there's a number of cycles, and number of the extent of the damage is being done by the coccidia. So ultimately, the major portion of the intestine is being damaged, and whatever the nutrition provided to the animal, to the young animal, is not being absorbed. So intensive system, it become a major problem. So there are a certain basic principle of the management of the coccidiosis, and the overcrowding is a predisposing factors. If you are keeping the animals in the poor space, it is bound to occur. And if you are keeping the younger animal to the adults, means adult is providing the infection, so it is a better approach to keep the younger animal from the adult. So avoid the infection. Ensure the shade are cleaned. You know, it is an environmental infection, so time to time cleaning of a farm. Replacement of the soil at a regular interval. It is one of the better approach at a time interval, 3 month and 4 month interval, especially when the farmers are keeping the animal on the kacha floor. So it is an approach that the top 6 inch infected soil can be replaced by the new soil. So it means you are eliminating the infection. Sprinkling of the lime powder inside the shed, it can control the infection. And there is a two approach. One is the treatment, and then another is the preventive approach. In treatment approach, we have a different drugs available in the markets: sulfadiamidine, amprolium hydrochlorides, nitrofurazone, and toltazuril. The most commonest use are the sulfonamides and amprolium, and you can use at a definitive dose rate for a very longer of time, especially 5 to 7 days of time. The preventive coccidiosis are generally recommended if you are having a organized farm. So at the age of the 2 to 3 months of time, when there is a possibility, there is a compilation of the infection in the intestine, you need a coccidiostatin. So it is a basic principle that in comparison to the treatment schedule, if we are lowering the dose rate and increasing the period of administration, it works as a preventive dose rates. But this is a very necessary guidance that when you are using this drug at an early age of life, means 1.5 months of time, when the early infection is very necessary to provide the protection to the animal by developing immunity. So the early dose should be avoided. So in our experience, 2.5 months and 3 months time for a preventive coccidiostatin is an ideal time. And sometimes the adult animal is also having a high load of infection, although they are not exhibiting any sign. But it is a strategy also provide the treatment to the adult animal to decrease the load of the infection in the animal and the decrease of the infection in the environment. For a long-term approach, different antibiotics is being practiced, like monensin. Monensin is an antibiotics, but now at time the government is not permitting to use any kind of the antibiotic growth promoters because it increases the risk of the resistance. Otherwise, the monensin has been in use in the past. We also have a very good experience of using monensin for a period of time, but after a 4 year of time, this drug has become ineffective as the resistance is gained in the coccidia. Coccidial management is also needed different approaches because it is a very common I would say the approach. The animal is gaining the infection from the adult animal or the contaminated the feed in fodders. So the raised platform is being used because to avoid the infection, and raised platform it is very commonly adopted. So the fecal palate is dropped down and there is a lesser risk for the younger animal to get the infection. Enterotoxemia, the younger age of life, is also become a problem of a mortality, and the young animal, 3 months and 4 months of time. So sometimes it become a problem younger animal, as you have been experiencing this enterotoxemia perfringens, this in the younger age of life. So it is a very important disease involving the young animal and associated with the sudden feed of change. But this is not a prerequisite, and this enterotoxemia is an important disease because of it affecting the good animal. Hence, it is very important. There are the different type of the clinical symptomatology. In acute case, there is sudden abdominal pain, lack of coordination, and the acute death. In chronic form, there is a chronic diarrhea and progressive weight loss. Generally, this type of the chronic form is being neglected by the professionals. So you need a proper attention to diagnose the disease by the different kind of approach. Impression smear is dominant by the large number of the gram-positive organism, and the multiplex PCR that diagnosing the toxins especially. That is an important diagnostic approach. You see the management and control of enterotoxemia. Generally, the enterotoxemia is having a very grave sign. It is acute mortality. But in chronic, you have a time. Otherwise, in acute clinical symptom, the doctor has no time to treat the case. The fluid therapy involving the electrolytes and bicarbonates, and to combat the shock, steroids and some non-steroidal anti-inflammatory are generally recommended. The antibiotics are responding are penicillin, tetracyclines, and if there is a risky cases, the oral dose of tetracycline bolus is also useful to control the multiplication of the Clostridium perfringens in the intestine. Although in the past the antitoxin against the ET were in common use, but now this is availability is questionable. Otherwise, in acute case, the anti-sera against type C and type D is very useful. So we have ET vaccine to control the enterotoxemia. If you see the comparatively, the ET vaccine is not very effective in goat, and it need a very frequent repetition in goat especially. So we also surveyed on the antibody titer status after the present ET vaccination. We found that after the 4-week of the 12-week post-vaccination, there is a weak responders. The antibody titer is weak. So it needs a frequent repetition. That's why we are recommending that farmers use the frequent repetition at the 6 month of time. But whenever there is a high risk of ET in the farm, you can still, earlier you can use the vaccine 3 month and 4 month time. So considering this, that we are also running a project in our institutions to find out a better, I would say the enterotoxin, this Clostridium perfringens prototype vaccine that can work more efficiently, more effectively in the goat. PPR is a very common disease. If the animal is not protected by the PPR vaccination, young kids may suffer from the PPR. And there is a high risk and high mortality. And the clinical signs are very clear to all. It is pneumonia, diarrhea, and buccal lesions are common. So that's why the vaccination in the adult animal is recommended. The goat pox in young animal. Again, the dam is not vaccinated against the goat pox, and there is a high risk of the occurring of the goat pox in the younger animal, resulting in a very high mortality, sometimes reaching to the 80%. So the goat pox vaccination is very, very common. So this goat pox in the Black Bengal bead goat is very, very high, very highly susceptible. So now we come to some basic managemental practices to minimize the kid mortality. So there is a basic concept behind it. Kidding should be a well-anticipated event, not an unexpected surprise. Means when you are rearing the animals in a more organized sector, you should breed the animal a particular period of time. It means when there is a kidding at one point of time, you have a better management practices and you can handle the situation more smartly. So the kidding should be a well-anticipated events. Otherwise, if there is just like a maternity home, then the infection is continuously being maintained and is very difficult to control the problem of a kid mortality. So the basic thing, you have a well clean, well lighted, well bedded, well ventilated pen to providing the better environment to the younger animal. And second most important is the naval management. The naval management is important to avoid any risk of the entrance of the pathogen through the damaged navel. Clean water and clean milk, the basic principle to avoid the oral infection. You provide the clean water by disinfecting the water by the caminophore. Although the caminophore is a weak disinfection, it takes a very long time to disinfect the water, and especially when there's organic matter is very high. So you have a better option, bleaching powder and chlorine tablets, and provide the clean milk. Suckling should be allowed after the washing of water. This is the basic thing. And sometimes if you practicing this approach only, the mortality, the risk of the mortality is declines. Although it is very simple, but it is a very important one. Second thing, which is very important to prevent the mortality, is the pregnancy management. Pregnancy management means when the dam is getting the proper nutrition, proper care, there is a lesser risk. So in the pregnancy management, the first is coming this dam vaccination. Dam vaccination means the most commonest organism which is associated with the mortality in the younger one, you require to vaccinate. So there is a need of a vaccine that involving the E. coli, rotavirus, Clostridium. So international markets, there is a vaccine is used as a dam vaccination to provide the protection through the better colostrum quality. Although we do not have at this moment, but there's a project is going on to develop a combined vaccine to prevent the infection in the younger animal by providing the passive immunization. The smart management is a very important thing, because the management plays a very important role to control the infection. Colostrum, timely colostrum, or sufficient amount of the colostrum, it is important, or with a sanitation. So the colostrum, when it is not available to the young one, there is other approaches is also can be practiced. Although for example, like the frozen colostrum powder, although the availability of this type of the approach is not very common, but in near future, because the goat industry is now coming up with a big way, so all these possibility of the colostrum will be there in our country. So the colostrum of the other species can be given. The colostrum is a major important management you need at the timely and sufficiently. The another approach is to improve the passive immunity. In passive immunity means you are improving the immunity of the pregnant dam. There are the different approaches, and this, if there's a proper immunity in the dams, it will transfer to the colostrum to the young one. It will provide a protection in the younger phase of life. So to improve the passive immunity, there are the various approaches. Either you can increase the passive immunity by using the mineral supplementation, especially copper and zinc, or passive immunization through the important diseases like vaccination and prebiotic therapy, herbal immunomodulatory. There are certain herbal drugs, for example, Virginia, some Giloe, some other plants, which is very common. So we are also working on these directions to provide the herbal immunomodulatory plants in the form of the powder for a period of 1 month of time before kidding. And that provides that increase the immunity in the pregnant dam, and thus immunity is being reflected in the colostrum. So the colostrum quality is improved by improving the immunity. So it is a better approach. We also work on that, and we develop a drug that's IME4, and it is commercialized. But as a general, if you are providing the herbal preparation in the pregnant stage, it works. It improves the immunity in the dams and transfer to the younger kids through the colostrum. For innate immunity, you can improve by using the prebiotics like mannan oligosaccharides, and that is also providing the better the microbial environment to the younger kids. Prebiotics and the postbiotics that can be utilized. So there are the certain practices that needs to adopted by the farmers. Avoid overcrowding. Crowding is the major risk because the transmission of the disease is faster. So there should be proper space. By that day, you can also addressing the animal welfare issues. Keeping kid away from the adult animal. Minimum intake of the infection. It is generally practiced. That's why in the rearing practice, in the organized sectors, the animal is being kept as a age-wise. Young animal up to 1 month of age, then 1 to 3 months of age, 3 to 6 months of age, and then adult animals. So there is a risk is decreased because of the transmission of the infection from the adult goat. As you know, the fecal palate is a loaded infection. It contains the E. coli, viruses, protozoa. So all kind of the infections are coming through the fecal palates. So you should keep away the younger animal from the adult animal. Irregular cleaning of the premises is a important criteria. Means you are removing the infection as early as possible and cleaning the environment. Sprinkling of the lime weekly, fortnightly. It also minimizing the infection on the topsoil. Removal of the infected topsoil, replaced with the new. It is a good approach if the farmers are rearing the animal on the kacha floor. And the timely vaccination. It is very important. So these are the vaccination adopted to the goat and sheep. So thank you very much.